With the new year, facing the same viruses making more and more people sick across the Badger State. Thanks for joining us. I'm Melissa Langbed.
And I'm Eric Morotek. It's that time of year where illnesses are spreading around, whether it's work, school, or even your home. News 9's Viana King joins us live with what you can do to help stay healthy.
That's right, Eric. You mentioned the big three. That's the flu, RSV, and COVID. According to the CDC, they've estimated there have been around 7.1 million cases of the flu, with 73,000 hospitalizations and 4,500 deaths just this season. And experts say COVID and RSV could be just as serious. During the winter months, viruses like the flu, COVID, and RSV are plaguing homes, workplaces, and schools.
They're all spread through respiratory secretions. People who might be coughing or sneezing and contaminating the environment around them, thus infecting other people who are very susceptible.
Although there's not one specific reason, it seems like everyone is getting sick. Holiday get-togethers and spending more time inside don't help.
This is the second year that we've had RSV, flu, and COVID all circulating at the same time at very high rates. And that has led to more hospitalizations. With RSV, the hospitalizations have been primarily with younger children under 5, especially children under 2 years old.
He also advises older folks to be on the lookout for COVID.
COVID, it's across the board for all ages. Influenza, we're seeing a little bit more than what we expect to see in the older adults as well.
UW health officials want you to prepare ahead of time by getting your vaccine. To that, if you do get sick, it won't be as severe.
To make sure that you're up to speed on your vaccinations, so worst case scenario, this is an inconvenience to you rather than a medical emergency. In the moment, things that are important, good hand hygiene, make sure that you're washing your hands often, maybe carry that alcohol hand sanitizer around with you.
Although these illnesses are impacting the nation as a whole, the DHS wants to remind people that these illnesses vary depending on the region.
We can expect at least another 2-3 weeks, maybe even 4 weeks of increased activity. RSV in and of itself has started to plateau and starting to come down nationwide, but that's because in the southern states like Mississippi, Florida, Texas, where it started earlier, they're now seeing a decline. We're not seeing that in the northern states at this particular point. We want people to be very aware that we are in the middle of what could be a very rough respiratory virus season.
Now, both experts recommend mask wearing and staying home if you feel ill to protect yourself and those around you. In studio, Viana King, News 9 WOW.